Today, we will talk with you about how to cope with chronic subatopic pharyngitis, how to alleviate your condition, what needs to be done to avoid deterioration and relapses. In general, about everything that is important for the treatment of chronic subatrophic pharyngitis. If you came for a magic pill, I will disappoint you and you can switch immediately and right now to another video and not waste your time. But if you are ready to work for the sake of your throat and your health, ready to change something in your life, ready to help doctors cope with your problem, then this video is for you. Get your pens, notepads or notebooks. Ahead of you is a lot of important information. I am Dmitry Krabrov, a doctor from Arena Laryngolog. I've studied medicine for 25 years and have been treating chronic upper respiratory tract diseases for 15 years. In my method, which shows high effectiveness, I apply 5 directions. This is definitely the right motivation for health. The second direction is work with the cause. The third direction is health methods. The fourth direction is psychosomatics. And the fifth direction is resource state, how to charge your battery to be healthy. And in this video, we will talk with you about the causes that lead to chronic subatrophic pharyngitis, including psychological reasons. They are always there. About means to alleviate your condition. About means and methods of restoring the mucous membrane so that your throat stops bothering you. Let's talk about the main causes of chronic subatrophic pharyngitis. In general, what is this problem? It's a weakness, depletion, deterioration of the functional properties of the mucous membrane of our throat. The mucous throat performs several different functions. One of the main functions is the transportation of mucus. A lot of mucus is formed from the lungs upwards. Then this mucus mixes with saliva and we swallow it. Mucus forms in the nose, which flows into the nasopharynx and throat. And if the mucous membrane works normally, the cilia function, then we feel the throat as healthy and comfortable. But if the mucous membrane loses its functional properties, the cilia work worse, the mucus becomes thicker, more viscous, and we start to feel dryness in the throat, tickling, hoarseness, dry cough. So, what can lead to the deterioration of the functional properties of the mucous membrane and its thinning? First of all, these are external influences, that is, the effects of the environment. Most often, the problem arises in people of certain professions, especially those associated with chemical production and chemical processes. If a person constantly inhales some aggressive airborne mass, then these substances gradually impair the function of the mucous membrane. And if this happens over the years, the structure of the mucous membrane itself changes. The ciliated epithelium becomes non-ciliated and leads to symptoms each of you already knows. Therefore, if it leads to symptoms, each of you already knows. Therefore, if you work in a harmful production associated with the inhalation of aggressive factors and you have started such a problem, urgently change your job. We must stop the intake of these aggressive factors so that the problem does not worsen and deepen. The next reason is an inadequate reaction of the local immune system, which also works on the surface of the mucous membranes to ordinary irritants that affect any person. Each of us encounters, for example, flowering, dust, various inhaled factors. And if the local immune system works adequately, then the mucous membrane simply cleans itself from these factors and nothing happens. If the immune system starts to trigger an inflammatory process on everything in a row, on what it should not trigger, then this small chronic inflammatory process changes the state of the mucous membrane over the years and leads to subatrophic pharyngitis. How can one suspect this condition in oneself? Very simple. You feel that your throat is constantly reacting to something, to some factors. Most often, such patients frequently suffer from inflammatory conditions. Because the immune system does not let any virus or microbe pass by, it triggers a minor inflammatory process for every virus and microbe. Therefore, if your throat reacts to everything in a row, if you often suffer from colds, if you easily catch viral infections from people around you, if someone in the office or in the family has a slight cough, some symptoms appear and you immediately get sick, then you need to deal with your immune system. You can turn to a good immunologist. In such a situation, when the throat reacts to everything in a row, there is always a psychological factor. Your body thinks that the world is unsafe and needs to be protected from it. That's why the immune system reacts to everything in a row. And from a psychological point of view, we are always in such a situation, figuring out what your body is afraid of. Why does your psyche react aggressively to the outside world? You need to pull the thread, unravel this knot, and see where there was such a situation in which your body, your brain, your psyche learned to react this way to the outside world. And the process of such diagnostics and the cause is an inadequate reaction of the immune system to the very mucous membrane, and the cause is an inadequate reaction of the immune system to the very mucous membrane, and in particular to the glands that produce mucus. An autoimmune disease can be triggered, which is called Sjogren's syndrome or disease. This is when, as a rule, in addition to everything else, a saliva deficiency is observed. In such a case, as a rule, in addition to everything else, a saliva deficiency is observed. And such patients complain about dryness in the mouth, extreme dryness in the throat. To confirm the diagnosis, it is necessary to consult either an immunologist or a rheumatologist. The nearby organs and systems can be negatively affected by the mucous membrane of the throat. For example, the nose. If some sort of mucus is constantly flowing from the nose, the mucous membrane can react to this over a long period, and its function may deteriorate. Therefore, if there are any symptoms related to the nose with the nasal sinuses, congestion, discomfort in the nose, flow into the throat, a feeling of pressure, discomfort in the nasal sinuses, sneezing, dryness in the nose, burning, anything you like, it is absolutely necessary for an ear, nose, and throat doctor to examine you and rule out problems with the nasal sinuses. When certain diseases are detected, treatment is carried out by an otolaryngologist to eliminate the influence of the nose and nasal sinuses on your throat. The stomach can affect the condition of the throat. Usually these are functional problems. Dysfunctions in the area of the bile ducts, throws from the stomach into the esophagus, various functional disorders of the gastrointestinal tract. All this can lead to an effect on the mucous membrane of the throat. If such influence is prolonged, if it is aggressive, then it can also lead to changes in the mucous membrane of the throat in the form of subatrophic pharyngitis. That's why we go to gastroenterologists and check our gastrointestinal tract. An increase in blood sugar can lead to such problems. Be sure to check your level, as this can lead to such problems. Be sure to check your blood sugar level and glycated hemoglobin level. That is, if your sugar level rises periodically, it always reflects on the hemoglobin. And the level of glycated hemoglobin shows if it is above normal, it indicates that the sugar level periodically rises. In such a case, it is absolutely necessary to consult an endocrinologist. The next reason is vocal strain. That is, if in your work or in your life the speech apparatus is constantly stressed, that is, if there are constant back and forth airflows, if your mouth, excuse the expression, does not close, and anatomically and functionally your throat is simply weak, then it wears out. Therefore, if you talk a lot, consider that it needs to be worn out. Therefore, if you talk a lot, think about what needs to be done about psychological reasons. How to understand, do you have them or not? About psychological reasons. How to understand, do you have them or not? Very simple. If stressful situations worsen the condition of your throat, if you go on vacation and your throat gets better, then psychological reasons are likely to be present. Any important thought that arises in you triggers some feeling in the body. Lastly, in turn, it triggers a reaction of our body. Any of our feelings have a certain location in our body, and you know this beautifully. Some people have most of their feelings located in their chest. Other people have feelings in their stomach, and a lot of feelings are felt at the level of our throat. And there are such feelings that cause a stress reaction at the level of the throat, which cause a deterioration of blood circulation at the level of the throat. So imagine if this feeling is constant, and it constantly affects the condition of the mucous membranes of the pharynx. What are you talking about? I'm not doing anything to the pharynx right now. What are you talking about? I don't feel anything right now. I have no feelings here. But in reality, we feel our body and can control our life no more than this is the level of our consciousness. That is, if we draw a pyramid, then we are aware of no more than 5% of our brain activity, and no more than we control our body, our life, and so on. Everything else is allocated to subconscious programs that we are not aware of. And there was a situation where you started to feel certain emotions, and your brain remembers the situation. And at the level of subconscious programs, this feeling is always there. And this feeling triggers some reaction in your throat. I've been tormented by such a question for a long time. Why it seems you explain everything clearly to patients, but they don't want to deal with their psychological reasons related to chronic diseases. And it turned out to be all banally simple. There is a dependency. The sicker this situation that triggered some feeling which affects and causes chronic respiratory diseases, the sicker this situation, the stronger your brain protects from it, the deeper it hides it and starts to justify to you that you have no psychological peculiarities, situations, problems, and so on. You get the feeling that there are no problems and so on. You get the feeling that I didn't have it. And about the significance of the situation, indeed, I didn't have it. And about the significance of the situation, indeed, it wasn't there. And the situation could have been trivial. For example, you were and were not. And the situation could have been trivial. For example, you were a little child. Take one of the situations that we recently worked through with a patient. He was a little boy and he was scared of the surrounding strangers. And in this banal situation, he learned that the world is dangerous and that I'm somehow not right. He began to defend himself from this surrounding world. He always had problems with meeting new people because his body, his psyche, learned to defend itself from this in childhood. But most importantly, this defense from the surrounding world began to manifest itself at the level of the throat, because the feeling was at the level of the throat, and the mucous membrane reacts constantly to everything in a row. And when we worked through this situation, when we understood that adults didn't want to harm the child, and that he just learned this, and in this situation, we learned and believed that the actual environment is safe and all these reactions, and believed that the actual environment is safe and all these reactions just disappeared. And believe me, there are certain techniques that allow to diagnose, to see where in which situation the feeling that causes these reactions of your body was triggered. And each of us has responsibility for our health. And you have two choices, either to take responsibility and continue to suffer from chronic throat diseases, or to take responsibility and try and go into this fear, go and remember the situation that caused the feeling that triggers the body's reaction at the level of your throat. To the methods of restoring the mucous membrane. First of all, in order to remove dryness and hoarseness, it is necessary to moisten the mucous membrane of your throat. The first thing we do is ensure normal humidity in the rooms where you are. The temperature of such air should not exceed 24 degrees Celsius, and the humidity should not be less. We regulate the temperature by covering the heating radiators. If only for the humidification of the mucous membranes, we can use special sprays. For the humidification of the mucous membranes, we can use special sprays. Firstly, we moisturize the nasal mucosa with any sprays with seawater, isotonic, or with saline solution, which we can pour into any spray bottle. There are also sprays with seawater for use in the throat. We use these preparations several times a day, maintaining the moisture of the mucous membranes. I recommend for moisturizing the mucous membranes, we focus on our own feelings, which should improve with the use of these preparations. If you observe a reverse effect, it means it doesn't suit you, and contraindications, a consultation with a specialist is necessary. The next method is inhalations. Inhalations and contraindications require specialist consultation. The next method is inhalations. I always recommend doing inhalations with mineral salt, for example, with 17 ash trees, or 4 ash trees with borjomi, that is any salty, and we breathe this moist air on average for 10-15 minutes in case of subatrophic pharyngitis. In the morning, we breathe this moist air on average for 10 to 15 minutes. You can do this in the morning, evening, or more often if desired. Oils help most patients with chronic subatrophic pharyngitis. But oils are most effective when used through the nose. That is, we drip oil into the nose. It gradually begins to flow onto the back wall and has its soothing restorative effect there. Of the many oils I've used in my practice, in my opinion, vitamin A oil and Viton oil, also known as Karavaev's balm, are the most effective. If your nose starts to react negatively to the oil, and if your nose starts to react negatively to the oil, with oils. In most cases, we boil them, prepare broths, or with oils. In most cases, we brew them, prepare decoctions or infusions. Marshmallow, coltsfoot, linden, Irish moss, mint, eucalyptus, ivy seeds have a very good soothing effect for the throat. Here everything is individual. We select, try, brew one herb, a second, a third. All recipes are available on the internet. We won't specifically dwell on this. The most important thing is that you evaluate the effect of this or that natural preparation, of this or that herb. If it eases the throat condition, we'll use it. If it doesn't affect at all or causes dryness of the throat, naturally we cancel it. I always prescribe such drugs as omega-3, vitamin E, and vitamin A for constant use to patients with chronic subatrophic pharyngitis. Omega-3 often goes with vitamin E and vitamin A, and as a rule it has to be added separately. But if you're going to use vitamin A for nasal instillation, there's no need to take it additionally in capsule form. There are medical procedures aimed at improving blood circulation in the mucous membrane of the throat, aimed at regenerating the mucous membrane and its restoration. Among the physiotherapy procedures, a red laser can help here. Among the medical procedures, we usually do injections of the drug in Moscow, in the Moscow region. I am engaged in this method. You can come to Moscow, in the Moscow region. I am engaged in this method. You can come and want to use my method fully to cope with chronic subatrophic pharyngitis, to improve your condition, the condition of the mucous membrane of your throat. You can use an online course on restoring the mucous membrane of the throat. To find out when the next course starts and all the conditions, follow the link below. There will be all the information. Or the link will appear right here now. In my method, I definitely use 5 components. We set up motivation for health, always work with the cause, add a bunch of useful health methods. As always, we process psychosomatics and charge your battery, work with the resource state. Therefore, if interested, come, we will restore your throat. If you are not subscribed to the channel, be sure to subscribe. Ahead are many more useful videos. Take care of your health and stay healthy. Your Dr. Krabrov.